Hi, good morning. I'm Dr. Gnirke with Vail-Summit Orthopedics and Neurosurgery. I'm an interventional physiatrist focusing on sports and spine medicine, and I'm here to help answer some questions with Vail Valley Live. All right, so our first question today is, when do you recommend injections over surgery and vice versa? So certainly this is a fairly complex question, and individual patient treatment plans are really developed in consultation with the patient in the context of specific diagnoses, severity, and underlying health factors. Generally speaking, chronic degenerative issues such as arthritis can be managed for several years with injections, whereas traumatic injuries or more severe degenerative issues often have to be managed surgically. But proper consultation with your physician will help come to the right answer on this question. All right, so our next question is, how long after an injection can I ski? So this really depends on the underlying diagnosis and type of injection that a patient receives. Typically speaking, we recommend at least a few days of relative rest after an injection. Our next question today is, can injections delay my need for surgery so I can get through the ski season? So this is actually a very common question that we get up here in the Vail Valley. Very commonly for chronic degenerative conditions such as arthritis of the knee, which is exceptionally common here in Vail. We are able to manage patients more conservatively to allow them more ski days through the winter, and patients often will defer surgical management to our mud seasons. All right, so our next question is, what is platelet-rich plasma and how does it help? So platelet-rich plasma is a relatively new treatment in orthopedics that utilizes blood platelets from the patient to deliver growth factors in an effort to improve pain and function related to typically chronic degenerative issues such as arthritis of the knee, chronic tendon and ligament injuries. It's also used as an augmentation to surgical procedures to aid in healing. Our next and last question is, why do you use ultrasound over blind injections? So typically speaking, image-guided injections are more accurate than blind or palpation-guided injections. There is some variability there, particularly in the knee. That's not necessarily the case, but particularly for deeper injections, imaging guidance ensures that the medication that the physician is injecting is delivered directly to the site of injury or pain. This has been Dr. Matthew Gnirke with Vail-Summit Orthopedics and Neurosurgery. Thank you for your questions, and thank you, Vail Valley Live.